This is a real milestone for the community and for the campus. 50 years ago, this started as a recognition on the part of citizens in Northern Virginia that we needed a place for people to come and to be seen and to be treated. And it started in a living room and grew as a community initiative. When the hospital first opened 50 years ago, we had 200 physicians and 200 employees. We've grown a little bit since that time, as you can see. We are now an institution that has 2,400 physicians on staff, over 6,000 employees. We're providing world-class medicine. We are engaged in groundbreaking research and education. But with all that we're doing, what we're still about, principally and primarily, is providing care.
It is right for us to gather today to remember, to celebrate, and to give thanks on the 50th anniversary of our hospital's dedication. May the remembrance of the founders' dedication and commitment inspire all of us to continue with a deeper sense of purpose and creative vision to meet the needs of our growing communities. We give thanks for all who have shared their lives to be a part of the living tapestry of care in this place.
I was talking to Donna Reed, who I believe is the longest tenured employee. She's a nurse in the NICU. Is Donna here? There she is, right over here. Let's give her a round of applause. I was waxing nostalgic about how long ago 1983 was, and Donna said, "Yeah, I remember you came like decades after I arrived." And as I'm looking around and I see Dr. Tartan and other folks here, I realize how long and deep and rich the history of this institution is. And as Reuven said, those of us who've come more recently stand on the shoulders of folks for whom an incredible commitment and investment was made on our behalf.
I moved into Fairfax County in 1966, and both of my children were born here at Fairfax Hospital. So in 1969, when the Tower Building opened, my son David, who is now in the General Assembly, was here being born. And then a couple of years later, in 1972, when the Neo Intensive Care Unit opened, my daughter Karen was born here at Fairfax Hospital.
The Beltway was not yet constructed. Tyson's Corner was just a country crossroads. Skyline was still a general aviation airport. Dulles Airport wasn't built, at least it wasn't open yet. Fairfax County's population was 261,000 people. Last week we got the notice that Fairfax County's population is now 1,086,000 people.
You know, 50 years of outstanding growth as Grace Lucas was around her kitchen table planning with the leaders in Fairfax at that time, as Frank Imes as the early first leader, administrative leader, began the great planning process. You know, they were all focused on people, around serving people. And when you look at the millions of people that we serve a year at Inova Fairfax Hospital and the Nova Health System, it's unbelievable. And I think if Frank and Grace were here today, what they would tell us is, you know, we have grown a lot, and we have unbelievable technology, great clinical service lines, wonderful programs, but it's really about touching lives.
I feel very honored and privileged today to be here for the 50th anniversary of the Fairfax Hospital as it was known when I came, and now Inova Fairfax. I came here 10 days before the hospital opened, and we opened on February the 6th, 1961. I will never forget that day. We were all so proud. There weren't many of us. I had 2 nurses, a nurse's aide, and myself. And our first patient arrived in the morning in labor. All thoughts of the opening ceremony left my mind. and it wasn't until I received a call from the Director of Nurses advising me that the ceremony was about to begin. I told her that I could not be here because I felt my responsibility was with my patients. She wasn't very happy, but later that day, this patient presented us with a lovely baby girl named Patricia. So I say now, happy birthday, Patricia. And many, many good wishes to this institution for all the work that it's done. It has been very fertile and has produced many children. And now it is pregnant again with another one. And I wish it and all of you the best of wishes and much success and continued patient care, which is known in the area as the best. Thank you.
Mary? Thank you. We're sorry that you missed the ribbon cutting, and better 50 years late than not at all. So what I'd like to do is ask some other friends to come up and join us. Bill Foster, who's president of our auxiliary. The auxiliary is a crucial part of what we do, and these are volunteers who give of their time. And also, Jack Lucas is here today. And Jack is the son of Grace Lucas and a member of the Inova family. Jack? Jack, would you like to come up, please? And Bill? And if you'd like to take a scissor. And 50th anniversary ribbon cutting.
I saw with my own eyes many, many times during my 50 years here how essential it was to recognize the people that work for the hospital. There is no one, in my estimation, who better epitomizes the image of the physician within Fairfax Hospital than Nelson Tart.
I have been informed recently that my privileges were given to me September the 27th, 1960, 4 months before the hospital opened. During these 50 years and 4 months, I have been here almost daily. But the people who have done the work are here. They're the people I would like to thank today.
It is our honor and pleasure to have the cake cutting done by Dick Foster, who represents the original administration, and Mary Brown, who represents original nursing. I said to Dick, do you think we need a rehearsal for this?
The answer should have been yes.
Dick will present the first piece to the current administrator of Fairfax Hospital, completing the symbolism of the entire